Hi, this is Jamie Simmons from Covantix. I've got up on the left, I've got the provider portal, web GUI based model. On the right, I'm mirroring our mobile app. I'm going to walk through a quick request consult process. I'm going to click on the button below. I'm going to skip updating vitals. I'm going to select the type of consult that I want. And then I'm also going to select COVID-19 as an option for screening. I click next, and this is confirming who the consult's for, where I'm calling from, the address, best contact information, etc. Click next. This is the confirm pharmacy page. If the patient has a preferred pharmacy, they can pick it. And again, this is just test stuff here. So moving along, we got COVID-19 screening. So we'll say 98.9, 72, 71. Oxygen saturation, we'll say 93, and then we'll say blood pressure 132 over 90. And then we'll say coughing up blood, just randomly clicking some other things here. Next. And then this is the chief complaint and associated symptoms, where you can select more. And then terms and conditions. We'll skip those for now. See a doctor now. If you want to schedule an appointment, you can select a doctor. You could look for different doctors and review their bio. And then select their time. There's the bio. We don't have a bio for this because it's a test doc. So let's say we want it tomorrow at 10:45 a.m. That's what you do, and you say select, and then you'd submit it for that. But we're going to just show the other quicker way. See a doctor now option. So I clear the selection, click see a doctor now, submit. So there I've submitted the consult. Over here you can see it, and then there's the confirmation that we got it. And then coming over here to the waiting room, you'll see that consult request pop up here any second. And there it is, the latest scheduled ones. The doctor will go ahead and click on that. And he's going to accept the consult. This locks it to all other doctors in the Uber Now model, or any doctor now model. Here's the chart, personal info, contact preferences, consult info. Basically, the doctor would review all these things, medical history, social, family, and select them as they're being reviewed. Drug prescriber, physician name, past physicians, and here's the COVID-19 screening. And these are all flagged here because they're above the nominal value for COVID, so there's a good chance that this person may have COVID-19. Then you have, in terms of contacting the patient, you have two options. You got video and audio. I'll do audio briefly. Got to replace this because, again, it's a test account. So I'm going to put in phone number, a call. That's going to ring the phone. It's going to pop up over here. You'll see the call here in just a second. But there it is. And it could be, you can set up a caller ID, etc. I'm going to decline that. Goes to voicemail. And then for video, now for the video, we click video, and that's going to launch a video request, and that'll be sent to the app as well. And I'm going to click join to go ahead and connect the two. Then this will send a message back to the provider's app, and the provider will click join. And there's the image. Clicking video again, consent, accept it. And then we got a couple things going on here, so I'll click join. So this will show both me as the patient and the doctor. Before, I think I had the old audio call hanging out in there. So. And there's going to be noise because multiple microphones plus some recording. So that's the video, and then okay. And then once the consult is done, the doctor would come down and review all this stuff, and then have the option of, documenting an assessment plan and a treatment plan. And then for orders, you could click an order, select the type, These are all custom orders that can be designed to your needs and also branded as well. This is a web form, and you can enter in the drugs here and then select the pharmacy to send it to, or just use the patient's pharmacy. And then you just enter in the dosage, refills, etc. And then when you're all done, you gotta sign it, and that'll put in that signature in there, which is chicken scratch, and then save that. And there's your order. And once it gets done, it'll get sent to the pharmacy. On the diagnostic side, you can also enter in different conditions down here, and it'll automatically populate the ICD-10 code for you. CPT codes are fairly standard, and then follow-up recommendations. If you're not better within 3 days, go see your dermatologist or behavioral health therapist, whatever. You also redirect the patient and add notes. That's some backlash from the phone call before. So anyway, that's a brief overview.